Brought to you by GTA, your island, your network.
Patients can now get certified, and while the island's medicinal marijuana program slowly inches toward implementation, Public Health Director James Gillen already sees potential to expand the market in the future.
So there is potential, if we could get this off the ground, to have an industry that would also include the Japanese people coming for medicinal purposes.
This is because medicinal marijuana is currently outlawed in Japan.
This Japan Medical Association does send people to Washington and Oregon, and when they come home, the Japanese authorities have no problems as long as they're not bringing anything back. So they allow people to leave Japan for the sole purpose, or for the purpose of getting access to medicinal marijuana.
While Gillen said he thinks the program has a potential to bring visitors for medical care, he did raise concern about any efforts to legalize the drug altogether.
I think the Guam Visitors Bureau has a good point, in most of the countries where we get our visitors have a very negative view of marijuana as a recreational drug.
But he said the possibility of treating foreign patients wouldn't only spur the cannabis businesses in Guam, but others as well.
And that could even be terminal Japanese patients who need hospice care. I don't know how it helps people with temporary, use, but, if they want to come and they want to at least, have access to it for a short period, for the amount of time that they're allowed to stay on Guam, that's fine for us. That's another industry that can get built up in terms of, just more apartments, hospice care. That's when I think the whole medicinal marijuana business could start to take off.
Without foreign patients, he said an initial survey found that there may only be 3,000 patients eligible for medicinal marijuana use in Guam. However, changes to the existing law that allow physicians to prescribe medicinal marijuana for any condition they deem will benefit from it could mean that the number of eligible patients is larger than originally anticipated. However, before the program can expand, new standards and a laboratory need to get off the ground so the program can finally get up and running.
Brought to you by GTA, your island, your network.